Hi, this is Eric with Motion Guidance, and today we're going to be doing some tutorials in quadruped assessment for trunk stability. We have had several emails, inquiries, recommendations for how to do this assessment and treatment, and we're going to be going through that today. For the trunk quadruped assessment and treatment, we'll need the large motion guidance belt, the perpendicular mount, and a single laser. So I'm going to have Megan put the belt on around the top of her pelvis. As she puts this on, it's a feedback loop, so you slide it through the clip, bring it around, comfortable but secure with the blue field in front. Now, we don't want two layers of clothing around the belt in the sense of this is a shirt and then shorts underneath it. We want the shirt to be pulled up, so when our arms are moving, it doesn't pull on the strap of the motion guidance system. We can put that perpendicular mount, the clips go on the blue field. To place the laser with the ball and socket, we secure it from the side, slide it on to the ball and socket, and position it on top in the perpendicular position. Okay. Then we can have Megan assume the quadruped position. From here, I can have the patient just go through a setup. I don't need to turn the laser on from the motion guidance system yet. I can align the patient like I prefer as a clinician. I can have the shoulders in line with the wrists and have the knees in line with the hips. So I'm going to have you move your hips back just a tiny bit for me. In this position, I also don't like the sustained plantar flexion position. So I can get a pillow to put underneath her ankles to take her out of that forced plantar flexion. To start with assessment in the quadruped position, we want to not have the laser on for the system yet. I just want to watch Megan move. So let me have you bring your spine toward the ceiling and then come back to the starting position wherever you were before, and then go the other way. Can you drop toward the floor? Okay, and come back up. One example of some deficiencies that we see in the quadruped position that show up quite nicely is the inability for the patient to disassociate motion from the lumbar spine from the rest of their spine in the thoracic area. Okay? We saw there Megan being able to get a nice flexion out of the thoracic area and extension out of the thoracic area. I'm going to be curious whether she can get extension and flexion isolated as much as we can down toward the lumbo-pelvic area. So I'm going to put my forearm underneath the lower part of her ribs and a hand directly over the top. And I want to see if she can move into lumbar flexion from that position, so tailbone down, and then come back to the middle. And then tailbone up, or lumbar extension. Okay, and come back. After this assessment, depending on what the clinician sees, if you want to treat something, we can turn the motion guidance laser on, project it out in front, to where the patient can see it underneath their stance. And I can have them go through the same motion that we did during assessment. So I should go tailbone down, and we should see the laser start to move up between her shoulders or under her eyes and come back to the middle position. And then we can go tailbone up, or lumbar extension, and have the laser drop down further away from her gaze and come back up. To gain an assessment on the amount of movement that the patient can perform with this activity, we can use a motion guidance drop target and put this underneath the patient, have them not move, and then I can center the laser over the center of the target. Okay. Now we can perform that movement again. So go ahead and go tailbone down, go into lumbar flexion, and we can see how far the laser will move on the target and come back to the middle. And then go tailbone up, or lumbar extension, and see the laser move below the target. While the patient's moving, I'm still assessing where their motion is coming from and whether I need to change anything that I deem inappropriate. Let's try two more. When I'm with one of my patients in clinic, I will oftentimes stick with a purely external focus cue and have them move the laser up on the target and then come back to the middle, and then move the laser down below the target and come back to the middle. This will give me a nice visual assessment of where they like to move in order to achieve that task, and if they have any compensatory strategies that I need to change. Another way to assess lumbo-pelvic dissociation is by moving the motion guidance device up onto the trunk, projecting the laser out onto a target, then having the patient move their pelvis and their lower back without moving the laser on the target. So Megan, give that a shot for me. Very good. During this motion, if you notice the patient starting to move forward or backward to compensate for keeping the target in place, you need to correct for that if you feel like it's interrupting the goal of the exercise. So now we're going to have a progression of bird dogs. For this, we're going to take the large strap and have Megan move it up onto the lower part of her torso. And she'll have to tighten that strap. Comfortable but secure. Have the blue field in the front of her body, and then she can take the perpendicular mount and slide the clips onto that blue field. Perfect. Let's come back down into the quadruped position. Before I turn the light on, I align the patient into where I feel is the most appropriate position as a therapist or clinician. Then I can turn the motion guidance device on, projected onto the drop target. So Megan, what I want you to do is put your right foot back behind you toward the wall. And then come back in. During assessment of early stage quadruped activities, we're just getting a sense for how the patient likes to move. Now try the left side for me. And come back in. During that trial, when Megan brought her left foot back, we had movement of the laser outside of the center of the target. When she brought the right foot back, she stayed in the center of the target. I will likely consider this during the rest of my assessment to determine if there's something there that I would like to treat or address. Can you bring your right arm out in front of you toward the wall? And then come back in. And then the left hand out toward the wall. And come back in. When she brought her right arm out, the laser moved outside of the center of the target. The left arm it maintained in the middle of the target. So let's look at advancing these bird dogs. Bring your right leg back and your left arm out at the same time. And hold. Holding allows us to see static isometric contractions. Possibly get a gauge of fatigue during the exercise if the laser starts to move and shudder too much, or it moves outside of the middle of the target. And come back in. And try the other side for me. And come back in. At this time, I'll ask the patient how they felt. Was one side tougher to do than the other? Do they feel like they had more control on one side? Was there any pain with the activity? Do they feel stronger during one activity versus the other? One common compensation pattern that we see in the quadruped position with bird dogs is the inability of a patient to return to the start position while maintaining the laser in the middle of the target. So Megan, can you please extend your right leg back? In this position, patients often maintain the laser in the middle of the target, but their pelvis has dropped a little bit or their trunk has rotated. When they come back, that's easy for everybody to see because the laser moves outside of the middle of the target. They rotate the trunk in order to make compensatory movements, and then they realign themselves. This is something where the skill of the clinician needs to be shown by observing this motion, because the patient might see the laser in the middle the whole time and not pick up on this compensatory pattern. Let's try that again. So maintain that in the middle as you come back to the start position. This can be shown by putting the large strap around the torso or down lower, if it's appropriate for your patient, closer to the pelvis or the umbilicus area. After you've gone through your assessment with the motion guidance system and the patient understands the goal of the activity, you can start moving through progressions in the quadruped position. So we're going to go over some of those progressions right now. Megan, let's go ahead and go through a full bird dog exercise. So arm out, leg out. We can do holds, or we can quickly move through those activities side to side. Very good. We can also do reach under and touch. So we extend into a bird dog position, try to maintain the laser toward the middle of the target, and reach under with a hand to touch the knee, and then come back out. We would do those either repetitively on one side, or we could transition from side to side, which would increase the difficulty of the exercise. Good, rest. We can also do lower extremity waggles or upper extremity waggles, which essentially is an extremity disassociation from trunk movement. So extend a leg, try to maintain the center of that laser and move that leg back and forth. You can do small ballistic moves or large range, fast or small motions, giving the patient an increased challenge during this exercise. That's great, Megan. Try the right arm, same thing, and just movements back and forth. Wonderful body awareness with this exercise. Good. Okay. We can also go into a push-up position as a progression. I can move the pillow, and Megan can go through lower extremity movements, little hip extension, or we can bring her up into hip flexion from underneath, so the knee will come toward your elbow. Good. Or we can increase the base of support and go wide feet and try to extend an arm. This is very tough. Good. And rest. Once we have established that a person can control their body in space, we want to make sure that they can also move through space with that control. So the next phase of exercises in the quadruped position would be trying to establish increased motion during stability. So Megan, go ahead and go through the bird dog position for me. Now can you move that laser outside the target to the right? Good. And come back to the middle. Now move it outside the target to the left. Wonderful. Come back to the middle. We can easily establish range of motion goals by moving the target further and having the patient try to rotate toward the target and come back. Can you move even a tiny bit further and up into extension? Good. And come back to the middle. How about if we go toward the left side, Megan? Can you rotate and come back? And can I move that down and away? Can you rotate and acquire the target and come back up? Very nice. And rest. We can also do this in the push-up position. Megan, can you rotate that target to the right? You can even pick up an arm if you need to, and come back to the start position. And one more time, even further. Good, and come back. And can you go the opposite way and come back? Increasing difficulty would be picking up the right arm and rotating to the left. Good. And come back. Very tough doing that. And rest.